We are super, we are super excited to have you all here. It's going to be a great session today. And I'm just going to give one more minute to let some more people come in and then we'll get started. In the meantime, if you could put your name and your organization into the chat just so we can get to know you a little bit and see where you all are from. And we'll be getting started shortly. Okay, we're going to go ahead and get started. I'm going to run through a couple announcements and then we will move over to our presentation. So we are recording this session for educational and quality improvement purposes. By participating, you are consenting to being recorded, and if you do not wish to be recorded, please disconnect from the session. This is a community of practice. We really love having people from all across Utah, and we love hearing people's insights and questions along the way, so please feel free to ask questions and make comments throughout this session. So we will be starting with our didactic speaker, and then we will go into a small group discussion in breakout groups, and then we'll come back into big group to have one last overview of what we've learned. We ask that you protect individual privacy when you're sharing any information about another person or a child. Please avoid using any real names and de-identify any examples and situations. It would be great if you could rename your Zoom profile to include your name and your organization. And here's just an overview of how to do that. And then throughout the session, if you have any questions, you can feel free to raise your hand using the Zoom function to ask a question, or you can just send the questions into the chat. Me and Faustine will be monitoring it to make sure no questions or comments are missed, or you can just go off mute. We do provide certificate of attendance for all of you who participate today. The only thing you need to do to get that is to attend this, and then we will be emailing you a link to a feedback survey. It's very helpful for us to know what topics you would be interested in the future. We do have a Canvas and a website, so in case you want to look back on this session, rewatch anything, or view any past sessions, you can access our Canvas page by reaching out to Faustine, or you can visit our website and we have all of our past sessions on there. If we have our real situations, real solutions case presentations, if your program is struggling or you're unsure of any strategies to use with a particular kid or family, or you just want any strategies from this group, consider presenting a real situations, real solutions presentation. This is where we will talk in the small breakout groups for other people to be able to provide insights and information that might be able to help you. Our next session will be February 24th, same time, 1 to 2:30 p.m. And this will be all about transitioning from early intervention to preschool. So we will be having a panel of early intervention specialists who will be talking a little bit more about this. Our session presenter today is Chelsea Oakes. She works with the Utah State Board of Education as a preschool specialist, and we're super excited to have her. She will be presenting today on Stepping Stones to Special Education, a Preschool's Referral Blueprint. So with that, I will turn the time over to Chelsea.
I almost forgot to come off mute. I was going to just start talking. All right. Okay, well, thank you everyone for being here. Let me open the chat so that if people ask questions, I can see them. It's great to see so many people here, and hopefully we can answer any questions you have about the referral process to special education. I also see we have some people who are from local school districts, so hopefully if they could share any other insights as well. So this presentation is designed to help both preschool educators and families learn how to refer a child to special education, and kind of what that process looks like, because we know it can be a very confusing process. So we'll kind of go over what it looks like, what the best practices are, and then just what the law is as well. And then I'll also share a lot of resources. And of course, if anyone has questions at any point, please feel free to interrupt me, put it in the chat. I'm totally okay with doing that. I know some presenters don't love to be interrupted, but I am okay with it. Okay, so I wanted you just to get to know me a little bit. My name is Chelsea Oakes, and I work for the State Board of Education as the preschool special education specialist. My education, I actually have a bachelor's in English education because I had intended to be a high school English teacher. But a week after I got my degree, I had a baby and stayed home for about 7 years. And when I started going back to get renew my license and everything, I volunteered in my child's special education preschool classroom. And they kind of said, hey, there's, part-time jobs you could do while you're going back to school. And anyway, they sucked me in. And so I figured, why not work as the special education preschool teacher? So then that's where I got my master's in preschool special education, which is a little bit of a confusing name because it was actually 0 to 5 education. Special education, but that's what they called it. I've been working in public education for about 10 years. And when I'm not working, I enjoy traveling with my family, cooking new things, and reading. All right, so I know everyone put their name and where they're from in the chat, but if you would also just let me know what your role is. Are you the classroom teacher? Are you a coach, admin? Are you a parent? Are you in early intervention? That would be really great to see. And you can just say, you can put it all back in or just director. Perfect. So we've got coach, director. Great. Ooh, directors and coaches. And a parent. Perfect. Yes, we like to have our multiple roles. Okay, so we've got a lot of directors and coaches, mental health consultant, district manager. Okay, wonderful. Okay, so a lot of the admin's part and coaches, which is wonderful. Okay, if you haven't had a chance yet to put it in, please feel free to. I won't read it out loud, but I'll read it and just try to adjust as needed. It helps me kind of know what information to provide because it is going to be a little different if we're gearing mostly to parents or mostly to educators. Okay, we've got a childcare owner. Beautiful. Okay, thank you so much. Thank you all for being here as well. It's wonderful to have such expertise in the room and the virtual room because it's not actually a room. But okay, so my learning intentions are that by the end of this presentation, you should be able to explain how the special education referral process works, what you would be able to do, and then also be able to share at least 2 resources related to special education because there are a lot out there, but they aren't always something you're aware of. And so I just would love that. If that's all you could take away, that is perfect for me. Okay, so I want to start with a case study, which is not actually a case study. This is a stock image, and I made this story up about Jamie, but I hope that it's something you can relate to. So imagine that you have a preschooler named Jamie who is usually full of energy and eager to engage in classroom activities. However, over the past few weeks, the teachers noticed a change in behavior. Jamie seems overwhelmed during group activities, often covering his ears and looking distressed when the classroom gets noisy. He has also started to avoid eye contact and become increasingly fixated on certain toys, refusing to share or move on to other activities when those were not an issue before. During story time, which used to be a favorite part of the day, Jamie has begun to get up and walk around the room, no longer showing interest in the stories that once captivated him. The teachers observe that Jamie is not responding to his name as consistently as before and seems to be in his own world. So concerned, the teachers reach out to his parents and learn that Jamie has been exhibiting similar behaviors at home. So can anyone relate to this story? So I don't know if you want to put it in the chat. I can't really see everyone if you're nodding, but have you ever had a child in your class or your care that you're concerned about and you've noticed changes, or maybe they're a brand new student and you just go, oh, this is different. Like, this is not what I would expect. Okay, I see a yes in the chat. So hopefully you can relate. And sometimes we have a child that we're concerned about and we're just not quite sure what to do. And in that case, we need, oh, there it is. We need a little, if it'll go.
Help, I need somebody help, not just anybody help, you know I need someone help.
sometimes we need a little help. And so that is what special education is for. So I want to explain this process called Child Find. I'm not sure if you've ever heard of it, but it is a continuous process of evaluation and referral procedures that are designed to locate, identify, and evaluate children who are suspected of having disabilities and in need of special education and related services. So this is a mandate under the Individuals with Disabilities Education Act, also called IDEA, and it requires that all states have a comprehensive system to identify children who might need special education services. So this is even when a child may not actually may end up not qualifying, schools and LEAs in the state are still required to evaluate, to kind of make sure that they find all the kids that might need it. And this allows timely interventions that we know significantly impact the children's educational and developmental outcomes, because we know earlier the better. And so if we can get to them as soon as possible, then we can really help find them the support that they need. So this is something that all LEAs is what it's called, but local education agency, they are responsible for all children in their boundaries, regardless of enrollment. So in the preschool world in Utah, an LEA is considered any public school district. In the K-12 world, that can also include charter schools in Utah, public charter schools. So they all will have the responsibility of Child Find. This means that even if they're not enrolled in a public school district, they are still responsible for kids that will potentially or could potentially go to their school district because they are in their boundaries. So this is why it's really important, especially in preschool, that we have those partnerships between private childcare and public preschool, because they can't find all the kids, right? They're not all attending school. And so we need that collaboration between both programs. So this is why it's really important for everyone to understand this process a little bit. We also, the Child Find responsibility and process also involves public awareness activities, just to let the community know about special education services, screening, evaluation procedures, all of the things that we can do to accurately identify children with disabilities. So this presentation is part of that process. I'm letting people know that this is something that's available, and that we need your help if you do have a child that you suspect, and that's what the referral process is for. All right. So we're going to kind of go through the referral process really quick, like just a high level overview, and then we'll dive a little deeper into what the eligibility and IEP meetings look like. So first we want to start with who can refer a child. Essentially, I list a few options here: parents, teachers, administrators, medical professionals, but really any adult that works with a child or has a relationship with a child who is concerned, they can refer the child to the school district. However, the caveat is that the first step that the school district will take is that they will contact the parents for consent. School districts will not evaluate unless they have that consent of a parent or a guardian. But at least letting them know can kind of start that conversation. If you already are working closely with families, that's a really great way you can make the referral to them and have them reach out. But sometimes families are a little hesitant to start. And so you are definitely welcome to reach out to the school district and let them know that you've talked to the parents and that, you know, they are expecting a call from them, but they were a little nervous to do it. Or, you know, you can just say, I'm making this referral for them. So once the school district does receive consent, they have 45 school days to evaluate. So that's a little confusing because sometimes it's not calendar days, right? So they have, if you suspect a child has a delay or a disability and you kind of start thinking about it in January, please don't wait until the end of April, middle of May, because then they may not get through the entire process until the next fall if they have the summer off. So that is a very confusing and often frustrating thing for families. I know that school districts try really hard to get things done before summer break, but sometimes it's just not possible. So just know that that is something that is a little confusing for families, that it's 45 school days. And then once that evaluation is completed, they have an eligibility meeting where they will determine if the child is eligible for special education. And if they are, then they'll make an individualized education program or an IEP, and that will address their needs. And if at any point the school district kind of says, you know, thanks for the referral, but we're not actually concerned based on what we can see from what you sent us, we're not going to evaluate. There is a dispute resolution process that you can take, and I'm trying to get my notes, but it doesn't seem to want to let me copy it. Okay, well, I will make sure that I put them in. I thought that it would let me copy. Maybe that's Google and not Microsoft doesn't let you copy and paste from your presenter notes. But on our website, which is schools.utah.gov, you can go to the special education section, and there's parents and student rights, and that will take you or it's student family rights. That will take you to the dispute resolution, and I'll make sure this all of the information is included in any of the handouts that we have. But essentially, that is a process that the state helps facilitate, where if the school district and the family kind of disagree, they can kind of have some mediation. Oh, perfect. And Hannah said she'll upload all resources and links to the website and Canvas. Perfect. So that is just a really great option, because sometimes when families go and then the school district says no, and if the family doesn't understand why there's a no, sometimes it's very confusing and it feels like they're powerless. So really letting them know these are your options. This is what you can do. It's just a really good resource for people to follow through. So just know that even if the school district kind of says no, or if they determine the child is not eligible and you disagree, there's always kind of that dispute resolution process that you can go through. And so as educators, that can be something we can help families navigate a little bit, letting them know that there are still options. All right. So going into the eligibility process. So first, there are, for the team members, there are 4 required members that need to be at the meeting and sign the documents. So the required members are a parent or a legal guardian, a regular education teacher, a special education teacher, and a representative from the LEA who basically has the power to say, this is what the school district can offer. Some other people who might possibly be there are related service providers. So for instance, if the child needs a speech pathologist because they have communication delay, or they have medical needs, or maybe they need physical therapy. So those those providers and specialists will also be present at the meeting. And then I also put others as appropriate. And this is something that a lot of people don't know, but parents can basically invite anyone that they would feel comfortable having there. One thing that is really useful, if you work with a child in your private childcare and you help take care of them every day and you have all of this information, you would be a wonderful person to go to that meeting. And if the family wants you there, then you are absolutely welcome to come and share that information. And that will really help the team to make any decisions, because then they'll have more data and more information. So just know that that is an option if you are willing or interested, and parents are also okay with you coming. When the team meets, they're going to go over all of the assessment information that they have. So this will include the formal assessments that they'll give and that the parents provided consent for. So these are your standardized tests that are going to be given the same way to every child. So they'll give some really great data that you can compare to other children the same age. But it's also just a snapshot of the child based on that section, that little time that they spent together. So they also include informal data, and this can include observation in the classroom, parent information. It can include checklists that like a teacher fills out, parents fill out, just a lot of, just a variety of informal assessments. And then this is the part that's the trickiest, is the requirements. So in order to qualify for special education, there are two things that the LEA needs to consider. So the first one is, does the child meet the eligibility for one of the 13 categories for special education? I'm not going to list them all because there's 13, but the two most common in preschool are a communication disorder, or basically needing a speech pathologist, such as maybe they speak well, you can understand, but they're not using many words, or they're using a lot of words, but you can't really understand what they're saying, so it's more articulation. It could also be they have disfluency, like they have a stutter that makes it really tricky to understand what they're saying, or all of the above. They may have all of those. So that's one category, and there are specific criteria that they would need to meet for that one, such as like specific scores and that it affects certain things. The other one that's really common in preschool is developmental delay, and that is where a child has delays in 3 areas that are mild, 2 moderately delayed in 2 areas, or significantly delayed in 1 area. And this is often when there's not an actual diagnosis and you're not really sure why the child is delayed. There's not a medical reason. It's not just speech. It's something, but we're not sure what. We just know they need support. And so we're going to qualify them under developmental delay, and try to get them the support that they need to help them catch up, or just get the support they need. So those are 2 of the most common. There's also ones like autism is one of the categories, deaf and hard of hearing, deaf blindness, others that are a little less frequent in preschool, but still frequent, still on option. And then the other part, that this is the one that's the most confusing, is they not only need to show they have that disability, but also that they have an educational need. So for example, I'm going to share my youngest, who is now 13, but when they were little, they definitely had speech delay. My friend was going to school to be a speech pathologist, and she told me that I really needed to take my child to get evaluated. And so while I was there, they asked if I had any other concerns, and I said yes. Their behavior is really, really bad at home, like really bad. So I did a little parents. It was called the Achenbach, the parent survey, where you do a checklist of how severe it is. And I'm going to tell you, I looked at this now that I actually understand what the results say. They were in the significantly challenging behavior, like really bad. So the school district looked at that and said, okay, well, we need to see this child in the classroom, because that's scary, right? They were like, well, how are we going to help this child with all these needs? So they wanted to see my child in the classroom, and they did an observation for a week. And their words to me were, your child is an angel. They are the best in the class. They're a peer model. They're wonderful. And of course, as a parent, that's really frustrating to hear, because I'm like, no, they really need help, and I need help. But they didn't need help at school. They did not show that educational need. And of course, the school district was wonderful, and they said, we believe you. We believe this is happening, but it's not happening at school, which means we can't really help. Like there's nothing we can do and work on at school, because we're not seeing it at school. So my child did qualify for speech because they had that educational need, but they did not have a need in behavior. And so even though I saw that need at home, and in other settings, if they're not showing that educational need, it can be really, it will mean they won't qualify. Even now, they're in middle school now, and they do have an autism diagnosis, which is one of the categories for eligibility, but they do not have an educational need anymore, because they're able to communicate, they're able to participate in the general curriculum. So they do not have an IEP. And so really you have to have both of those. And that can be really confusing to families, especially when they say, well, we have this diagnosis, but they also need to show that they need what is it called, Magnus? Specially designed instruction. I had like 5 words pop in my head at once, that they need that specially designed instruction from a special educator. All right, are there any questions about the eligibility requirements? Because I know that can be a little confusing. Okay. All right. So if a child is found eligible, in in either the category and the educational need, they will then have an individualized education program or an IEP meeting. Sometimes they are separate meetings, but generally the LEA is going to have it right at the same time as that eligibility. They'll just say, okay, we're moving to this next document. So you don't have to come back and do it a second time. But it just also depends on timing and what everyone needs. The team members are the same as who is included in the eligibility meeting. They may sometimes change teachers. Some of the bigger school districts have like a specific team that focuses only on eligibility because they're the ones who do the testing, and then they'll kind of pass it off to a teacher who is going to do the actual instruction. So that might change, but generally it's going to be a similar person doing both. The IEP is a very long legal document. So it can be really confusing to people who are not writing them every day. Even to people who are writing them every day, it can be confusing. So I've just picked a few elements that are really key to understand for educators and for parents. So the first one is the present levels of academic achievement and functional performance, a terrible acronym of PLAFP or PLAFP. I hate saying that. I'll just call it present levels generally, but if you hear PLAFP, that's what that means. But essentially the present levels are supposed to describe the child. So what can the child do? What are they struggling with? Include data. So data from the evaluations, data from observations, data from families, just kind of everything to get a full picture of what the child can do and maybe need some support in. So one thing that I like to tell educators and families who are working on this is if you read that and you go, well, that's not my kid, then they need to update it, because we want to read that and say, okay, yep, that describes them. That is my child, or that is the student that I work with. And so please don't feel like if you're going, well, that sentence doesn't really describe them. The IEP team, they may present like a printed document, but it's just a draft. It is not the finished document. So please know that it can be revised, and they're happy to do so. The next element that's really important is the goals. So those goals will often or should align with the present levels and what the teacher or whoever wrote them indicated the child struggles with. So the struggles or the things that they might have needing more support are generally going to become the goals that the child will work on. So goals are specifically what the child is going to do or be able to do within 1 year. They generally write it for a year, and then they should have some short-term objectives that they'll work on throughout the year to get to that overarching goal. And then services are what the adults or the providers are going to be doing. So this could be the special education teacher is going to work on academic or cognitive goals for 30 minutes a week in the general education classroom, or the speech language pathologist is going to work on communication goals for 20 minutes a week in a special education classroom or the speech room. And that just means that it's not in the general education classroom, but they're going to be pulled out into a room that's going to be just people who are working on IEP goals, essentially. So those are really the ones that are huge in the IEP. And honestly, those are the things that you're going to focus on the most to know, like, this is what the child is working on. And one thing I should say is if there isn't a goal in speech, perhaps, then they're not going to have services in speech. So that's something you need to kind of keep in mind. They are aligned. And so again, that's why it's really important to look at that. One caveat that I always remember as a parent before I knew anything about special education is it's really confusing. And so I asked multiple times, what does this mean? I know you told me what this means, but now I forgot already. Like, can you explain it again? And I've had parents do that to me as a special educator. And I want you to know that they do not mind repeating it because it is really confusing. So if at some point you have a question and you say, okay, I'm reading this IEP that the parent gave me a copy of, and I don't know what this section is, can you explain it to me? The LEA is always, or should be always, happy to answer those questions because it is a very confusing document sometimes with a lot of language that if you're not using it every day, it can be confusing. So please feel free to reach out to the LEA, the special education teacher, if you're working with a child who is on an IEP and the parents provide that information to you. Just feel free to ask questions because they can kind of give you that general, like, this is what this section is about. And then that can kind of help you understand. And also let parents know that it's okay to ask questions because it can be really confusing, especially and overwhelming because you get a lot of information thrown at you in those meetings. And that first one can be very overwhelming for parents. All right. Any questions about the IEP process and what that looks like? All right. Okay. So a few best practices that are really key for, especially for private childcare, because I know it feels like you don't have a lot of say in the process because this is something that the public schools have to kind of be in charge of. And so sometimes you feel powerless and are not sure what to do. So we know that successful referrals require collaboration and communication between parents, educators, and service providers. And often the public school is going to be going directly through parents. So because that's legally what they need to do. They would have to get permission to contact the private childcare. So one thing that you can do as a private childcare or a director or a coach is to follow up with the parents and just say, hey, how's that going? Do you have questions? Is there anything that I can help you with? And really just communicating that way is really helpful. It's also great if they ask for support, such as like documentation, data, that you are able to do that and provide it quickly because, again, there is that clock that the LEA kind of has to follow, but it also helps them make those decisions and get a full picture of the children. So again, that's also one reason that data collection and documentation, which we focus on a lot in the pyramid model, why that's so critical. Because that accurate and detailed data help to identify the child's needs and also inform what appropriate interventions and services are needed. So for instance, you could take data on, well, we've been working on identifying the first letter in their name for 2 months now, and they still only identify independently like 30% of the time. So that kind of gives the IEP team an idea like, oh, okay, so we really need to work on this and we need to do more than just what we would do with all general education students. Or for instance, you also don't have to make it fancy. It can be a tally that you write on a Post-it note with the child's name and the date, and you're just marking how many times the child is aggressive or how many times they cry or whatever you're tracking. So I know some people really want it to be like a fancy, cute document that you're using for data collecting. And if that works for you, and if that's what makes you motivated to use it, go for it. There are so many wonderful options online that are free that have already been created for you. But also know that your data does not have to look pretty and it does not have to be fancy. It can literally be a Post-it note as long as it has the information you need so that you can refer to it and say, okay, this has been a problem over the last couple of weeks and it's getting worse and not better. That can be really helpful. Are there any questions about referral best practices or just anything in general that we've gone over so far? Okay, perfect. All right, so let's go back to Jamie. So we remember that we left them when the parents and the teacher were talking, and the teachers suggest it might be beneficial to have Jamie assess for possible developmental delays that could be impacting his learning and interacting with others. So the private preschool decides to initiate the referral process. They document Jamie's behaviors, gather input from both teachers and parents, and then with parents' consent, they contact the LEA or the local school district to request an evaluation. So the local school district kind of then takes over the process. They get a official consent from the parents, and they assess Jamie. They include a special education teacher, speech language pathologist, and a psychologist who work together to assess his needs. And they observe him in the classroom, conduct assessments, and interview parents and teachers. And then they conclude that he would benefit from special education services, and they determine him eligible and develop an IEP. And then with that plan in place, Jamie begins to receive support from a special education teacher who collaborates with the preschool staff to implement strategies that help Jamie cope with sensory overload and engage more fully in classroom activities. He's also starts doing speech therapy to support his communication skills. And as a result of these interventions, Jamie starts to show progress. They're now able to he's now able to participate in group activities with less distress. He shares toys more often and shows interest in story time again. And the teachers and parents are relieved and hopeful as they see his joy in learning rekindle. And so this story again is completely fictional. I kind of made it up, but it's also just exemplifies the importance of that early identification and the positive outcomes that can result from a well-coordinated referral and support process for children like Jamie. And I see there is a question in the chat that says, I heard somewhere that when we refer a child to an LEA that we get charged for the referral. Is this true? That should not be true. So back where I mentioned FAPE, which is a free and appropriate public education, I'm not sure if anyone else has heard of that, but I have not. I've never heard that, and it should not be true because, again, the school district should be providing this as part of their child find, which again is required by law, and it should not cost parents anything. So even if the child doesn't end up qualifying for special education, they still will not charge the families for that, all of the evaluation or the meeting time or anything. They cannot charge a family for that. And then I missed Maria's question at the top. It said, can the ages and stages questionnaires be a good documentation to provide? Yes, absolutely. That is a really great one because that can be a screener that kind of says, okay, we have some concerns and now we need a little deeper. We need to dig a little deeper and see what else there is. So yes, that is a really great one. And I know that some school districts also use that one. So that can also just kind of save them time so that they don't have to also do that, give that same thing and do that again. But not all of them use it. So it's really great if you do have that to provide them. Yes, absolutely. Oh, I see. So does the private provider get charged for not being able to offer the child those resources? Resources as in the special education resources? Okay, yes. So sorry, I'm like reading and commenting. So the question is, does the private provider get charged for not being able to offer the child those resources? The answer is no, because special education is specific to the LEAs, the public school districts. They are responsible for providing those services. So if a child is eligible for special education, the LEA is responsible for providing those despite what the cost is. If the child needs something and that the team agrees that's something the child needs, then the LEA is responsible for providing that. It does get a little murky when the school district provides services in their program and then the child also attends a private preschool. Sometimes, depending on the school district, they might send a teacher to the private preschool and kind of let them show them how to do it or provide resources that can be used there. But otherwise, the private provider has the opportunity to say, well, that's something the school district can provide. We do not have that funding. We do not have those resources. So no, you should not be charged by anyone for not being able to offer services or resources to children. Mm-hmm. Are there any other questions or clarifications? All right, no, those were great questions. Thank you. All right, so Jamie's story is that golden, this is the best case scenario. He qualifies. he gets support and it's effective and everyone works together. But sometimes, like with my child, right, did not qualify for the behavior, and I as a parent was like, well, we really need support, like this is really difficult. Sometimes parents still need things that a school district can't provide, and so I want or won't be able to provide because they didn't qualify. So again, these resources will have to be included in the links. I was going to copy and paste them in the chat, but again, Microsoft doesn't like me to copy apparently from notes, so I'll remember that for next time. But these are some resources. There are so many others. I have multiple slides, so this is not just the only slide of resources. So the first one that I should have put first, and I'm not even sure if I included it in my slides, is really reach out to the school district. So again, even though my child didn't get services in behavior, I asked them, like, well, what can I do? Like, what things, like, what resources do you have? And they were able to sit down with me and share a lot of information and resources. They printed things out for me. And so I, as a parent, was able to take that and kind of put it into place at home. And it was really useful. So always feel free to reach out. I know that sometimes it's tricky with private childcare, talking to the public preschool, but really we need to collaborate. We really need to be sharing those resources. And so reaching out to their LEA, like their admin, or even just a teacher, and say, who can I contact for this information? I would really love some support. That's a great resource to go to. There's also the Children's Center. They provide mental health care to infants, toddlers, preschoolers, and their families and caregivers. I think they also have their own, I shouldn't speak to this. I know there's people here from the Children's Center. So if I speak wrong, please correct me. But I believe they have preschool classrooms that can help with services, but they also have people that can come and visit your classroom and kind of observe the child and give support and options of what you can do in the classroom. I don't know. I think I saw Teresa is here. I don't know if she wants to add anything about what the Children's Center can offer. Sorry to put you on the spot.
Yeah, it's okay. We do have a therapeutic preschool program that's located in West Valley City for families who qualify, for children who qualify. There's family therapy and our infant early childhood mental health consultation and our early childhood coaching and consultation teams both have programs that we have professionals who could come into the classroom and observe and support teachers and administrators in navigating this process and also helping to identify behaviors in the classroom and just supporting in whatever way we can. So feel free to reach out to the Children's Center if you especially if children don't qualify, then we might be able to help you find other avenues.
Yes, thank you so much. I know I was like started speaking, and then I thought I'm going to say something wrong, and there's people who know better that can clarify here. So thank you. They're a wonderful resource. Are these resource services free? Yes, they are. The Children's
Center. For mental health consultation as well as the early childhood coaching and consultation, those services are free. For the therapy side of it and therapeutic preschool, their medical insurance is involved in those pieces. So I wouldn't say that those are free, but and if families don't have insurance, there are some other ways that we try our best to support. So we try not to turn anyone away due to financial hardship. So yes, some services are free, and then therapy and therapeutic preschool are charged by medical insurance.
Thank you for that. I was going to say yes, and then that's good to know that that's not a blanket statement, but most services are free, which is really great. So there's also the Utah Education Network, or UEN. These are more academic resources. They will kind of help give some like ideas of activities you can do, things that you can kind of work on that way. And then, of course, you should all know about the pyramid model. But I did find there's an introductory course, I believe, and that's free. I believe that anyone can take it, and it just kind of gives you an overview of what the pyramid model is, to kind of see if you're interested in that. But then also the resources page is challengingbehaviors.org. You could spend days just looking at that website for all of the resources. They have them directed to parents, to teachers, just so many wonderful resources. And again, you probably are aware of that since you're here, but if not, it is really, really wonderful. And there's some really great things that you can use to help. Okay. Of course, the Utah State Board of Education, we're always happy to help. I put my email on the slide, the link. I also included Susie Estrada, who is our family engagement support specialist for special education. But she really is just, even if they don't qualify, she's super wonderful at kind of helping to connect people to resources. Included the special education rules, not because I think anyone loves to read hundreds of pages of law and rule, but just in case you are kind of like, oh, what did they mean when they said this? It could be something to refer to if you wanted to. And then we also have a newsletter that just provides updates every month with anything new that might be useful. Just kind of keeping up to it with resources, because those are available to anyone, even if they don't qualify. And then I just also included our preschool pages. We have one that's specific to special education and one that is more general to high quality preschool. That's for private, public, and all of the in-betweens for the preschool. And then of course, I did include it, including your local school district is a really great resource as well. And then there's 3 more that I wanted to share. So the Utah Parent Center is specifically for families who have children with disabilities. However, they do have like parent advocates who can go to meetings with you. So if you have a family that's really nervous to go to the meetings by themselves, because it can be a very intimidating process to go to these meetings with these professionals and talk about your child, and you just want what's best for them. So I really recommend visiting the Utah Parent Center. They have such great resources, but also like family support groups, parent advocate, just people who have been there and gone through the experience themselves. And then the other one that I cannot recommend even like highly enough is our care coordination through the Department of Health and Human Services. So this is a team of people who can walk any family through support and services that may be available for any child between 0 to 8. So not specific to preschool, but this is available to all early childhood. They can do things like they'll reach out to me and say, well, we have a child we think could be eligible for special education. I can't talk apparently. Who do we contact? Which school district would they even be in? So they'll do that legwork for you. I've even had one of them tell me they spent hours on the phone on hold with Medicaid because the family needed to work and they couldn't just spend hours waiting on the phone. So they're just really wonderful, and they'll help with whatever a family needs, which is really great. So that's a great resource to share with families. And then there's also the SAMI Center, which is a very specific group. It's a preschool as well, but they do have a really great program that helps. Very specific. It's an in-person, so you need to be close and all of that, but if it is an option that is available. And even if you aren't nearby, they might be willing to share. I'm sure they'd be willing to share resources and other things with you if you do reach out to them. All right. Any questions about resources or any that you have found that you want to share with the group? Because I know I did not include every single one. Okay. So that is the end of my presentation, but yes. Okay. I saw something and then it was the thank you. I do ask if possible. I know they just put in another link for for your certificate of attendance. If you can only do one, do that one, please. But if you are willing to do a second one, this one is really just for me to kind of know what was helpful, what wasn't helpful, or if you need like you have follow-up questions that you didn't want to ask in front of other people, you can put your contact in there. It just really helps me to know how this went. And I am the only one who will be reading it. So please feel free to say anything. Hopefully the QR code will work for you because again, I can't paste the copy and paste.
Yeah, and if possible, if you guys feel free to do Chelsea's first because we'll be sending out an email after this session with our survey. So if you want to do Chelsea's first, just so she can get that feedback, and then later, if you have time to do our survey, we appreciate that as well.
Oh, perfect. I think I remember you telling me that, Hannah, and I already forgot. So
No worries.
I just remembered you said it was okay for me to include it. So I'm like, okay. All righty. I'll give another minute with that up just in case you want to scan it. And I'll give you a minute to fill it out. I don't see people. I think everyone's filling it out. So I'm going to go just to the next slide that has my contact information. Please feel free to reach out anytime. I'm happy to try to answer questions or at least direct you to people who can answer them. So yeah, thank you all again for being here. And I know I finished a little early, but hopefully that works.
Perfect. Thank you so much, Chelsea. That was great.
Yeah.
This does seem like an extremely complicated process, so it's good to get it broken down a little bit. So we will now transition into the last part of our meeting, and we are going to get out a little early today, so we won't go quite till 2:30. But we just wanted an opportunity for you all to have further discussions on this in a way that might not be as intimidating as a full group, and just collaborate with your fellow directors and coaches on this call. So we're going to go into breakout groups for a few minutes. And if you wouldn't mind taking a minute to introduce yourselves, we really appreciate seeing your faces as we're in the breakout groups. And then hub members, if you could make sure to take notes and send those to Faustine. And then some discussion points for you all today. This is just to dig a little deeper on what Chelsea's been talking about. So are there any further questions about the referral process? We can get those to Chelsea. We can have you join her breakout group. How does your program handle these referrals? Are there any barriers your program is facing right now? Do you have any strategies to support parents? Are there any specific children that you're concerned about and you're not sure how to handle this? So these are just a couple of things that you can feel free to discuss or go off on whatever you want. And I'll make sure to send these questions into your group chats. And we'll come back around 2:05, just in large group to close up. So thank you, everyone.
Knowing who to contact, where do I get more information and all this whole thing. And it's just like, I think calling that child care coordination, referring the parents to the parent center, call Chelsea. I mean, I think that people want to know where they can go to get more information and how they can help parents more. So I would really recommend just, start making those phone calls. And I think it'll really help you.
Absolutely. And we'll make sure to make it very clear on our website to add all of these resources so it's easy to find, easy for parents and providers to access.
I think that it's the hardest thing is making that first step. Call.
Yeah.
And now that you know Chelsea Oaks and you have her email Chelsea Oaks, start there. Just start somewhere to make that process for kids who you think may have a disability.
Awesome. Thank you. And then Amy and Ankita's group.
We had Chelsea with us, so we were lucky. She answered all of our questions as we were talking. But that comment from Betsy did make me wonder, Chelsea, is there a sheet of information that lists like all of the special ed preschools phone numbers in every district that could go out?
Yes. Well, it's a part of our website, but I'm sure we could make like a printable one that we could, yeah. And I had linked that in the sort resources, but yes, I think that's a great idea too, to have like a printable that makes it easy, especially for those district or those programs that are over multiple districts, not just in one district.
Okay, awesome. Thank you, Amy. And thank you all for participating today. If you have any further questions, you can feel free to reach out to Chelsea or reach out to me and Faustine. And our next session will be on February 24th. So thank you all for coming, and I hope you have a great rest of your day.